Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. Good morning, everyone. I hope it's a good day for you.
Good morning, Doctor. How are you this morning?
I'm here with John Taronsky. Good morning. How are you?
I'm doing well.
We've got Aaron and Coop in the controls, running the booth, making sure everything is A-OK at
right.
WABC.
Team is here.
So I just want to spend a moment to remember John Kennedy, the president, shot 50 years ago. Only about 25% of Americans are old enough to remember President Kennedy. So I was surprised to hear that for most of us, and probably most of the listeners, we remember that day like yesterday. And we remember where we were and what happened and those 4 days of chaos and tragedy. And I just want to take a moment to reflect on his life. So 50 years since that moment. This week we had very interesting patients, and I wanted to speak about them because patients, when you think about each patient and my patients, some patients spend 2 minutes with me or 3 minutes, which is unheard of. I usually spend an hour or 2 hours with everyone who comes in, and we get the documents. We find the pathology, we find the tests, we find the blood tests, and I make a copy for the patient. So when they leave with more than they came. They leave with more knowledge, more information, more documents. They have a record of what's happened to them before they even came to me.
That sounds like a good plan, Doctor.
So we have a staff that's running around chasing documents from years before all over New York, all over the country, sometimes all over the world on patients who've had things done, and they don't even know they've had things done, or they don't even know the results of things.
Yeah, sure.
So we had a patient come in this week, and I spoke a little bit about the patient actually last week. It's a patient from California. They live next to one of the most famous hospitals in America, the hospital that developed CyberKnife. Okay, why do they come to Dr. Lederman and Radiosurgery New York when they live next to the inventor of CyberKnife?
Well, I would...
Well, they came for lots of reasons.
Yeah.
Number one is, if you have a tumor, you want to go to the person that has the most expertise. You want to go to a team that's together that has the most expertise, the best track record over years. They know that the newest gizmo is not necessarily the best gizmo. In fact, the newest gizmo is by definition the least proven gizmo, right? So you get on the newest gizmo, there's no track record. There's no proof. There's no legacy of what's going on. This man was a pilot for United Airlines, okay? So he knows what new gizmos do.
I'm sure he knows all about them.
He knows all about new gizmos. He flew for United for 30 years. He flew around the world. He knows new gizmos, old gizmos. He's had an acoustic aroma. He came in, and they purposely came in. We had a lot of conversations on the phone beforehand. They decided they're coming because we have the largest experience treating acoustic neuromas, which is a particular kind of brain tumor in the world. We've been at it for more than 20 years, nearly 25 years. and we have a beautiful track record. Our work is non-invasive. There's no cutting, no bleeding, no hospital stay. We have a team that's devoted to do this.
Right.
So it's a big plus for the patient.
I would certainly think so, definitely.
Now, one of our advertisements says Dr. Liederman is the only doctor who is board certified in internal medicine, medical oncology, and radiation oncology that's Harvard trained in New York City. So each of those specialties is 3 years. I trained 9 years after medical school. I went to school until I was 35 years old, continuously from age 5 to 35.
A lot of time in a classroom.
Well, it wasn't classroom. A lot of it was with patients
Right.
and in medical school and hospitals and training. So what does that mean? Well, for this man, he's a pilot for United Airlines. He came in with acoustic neuroma, and I examined him. I examine every patient.
Sure.
Well, not every doctor examines every patient.
It sounds a little hard to believe, but...
it's a tumor in your ear. Let's look at your ear, maybe.
Yeah, sure.
So I examined him, and he had atrial fibrillation. Atrial fibrillation is when the heart beats irregularly. And actually, when you have atrial fibrillation, about 25% of the people with atrial fibrillation end up dying of strokes. Because the heart's beating irregularly, the heart can't push all the blood out like it does in you, or hopefully me.
Right.
And so the blood stagnates there, turns to a clot, and then the clot gets sent out to the brain one day, causes a stroke, and the patient dies.
Gotcha.
So there's a man who came to me because of our track record with acoustic neuromas, that we have the largest in the world, that we have a team that's been together. We've been doing this for more than 20 years. And he ends up, hopefully, having his life saved twice. Number one, acoustic neuroma.
Yep.
He had treatment. He tolerated the treatment fine. We found the acoustic neuroma. He's now under treatment to get his rhythm back to normal. So I just comment on, there are advantages to have a doctor who's trained in more than one area, who really looks at the patient, examines the patient, and spends an hour or 2 hours with the patient to see what's going on, rather than assembly line medicine.
Right.
So we're lucky in our center that we're able to spend time with each patient and evaluate each patient and see what's going on, get documents, and do the right thing and send people for tests, whatever is necessary. So to you, Capitan, I'm glad you had a great trip back to California. They had a great trip in New York, and I hope his life was saved twice. So I had a funny email last night. Okay, many people hear the program, and they too bashful to call because they don't want to call us.
Yeah, we are live. I mean,
yeah, we're live. We're here. We're 2 blocks from Radio Surgery in New York from our office. I get to go to my office. I got a big muffin in my office. I walk over here. Here we are live Saturday morning, 50 years after the tragic shooting, murder of assassination of the president. So this man wrote me a letter. He said, well, tell me the truth. What do urologists choose for their prostate cancer treatment?
So asking you, what are your...
what is a urologist?
Right.
It was a surgeon who...
Sure.
His job is to cut on prostate cancer.
Right.
What do urologists do for their prostate cancer? So I guess it's like, what kind of toothpaste do dentists use?
Right, exactly.
Because I asked my dentist a few weeks ago, what kind of toothpaste do you use? And she said, are you crazy? They're all the same. Just brush your teeth.
Right, right.
So anyway, I wrote him back, and I said, the question really isn't, what do urologists do for prostate cancer treatment for themselves? The question is, what do intelligent people do for prostate cancer?
Right.
Okay, so what does an intelligent person do? Well, an intelligent person would look at the data, right?
Anything else, sure.
I mean,
Analyze the data.
Do you want to believe that Crest is the best toothpaste or whatever, or XYZ is the best toothpaste? There's probably data out there, and probably my dentist looked at the data and saw that, you could buy one for 99 cents, or you could buy one for $19.99, and
the outcome is the same.
Probably if you floss and you brush, you're probably A-okay.
Right.
Anyway, so I said he went for kidney stones, and all the urologists the patient told me, would talk about was his PSA in prostate cancer. And the patient was really turned off about it because he didn't have prostate cancer. His PSA was relatively low. The urologist kept pushing him for a biopsy, and the patient just walked out of there. He called me up. He came over to my office. I saw him. I repeated the PSA. It was 2.29, not 2.9. I reassured him he's 45. His PSA is low. He doesn't need anything. And this whole idea of getting biopsies and creating an assembly line is just, I think, wrong. We've talked about it, and we talked about the article from New England Journal of Medicine, which showed that urologists who own radiation facilities increase their referrals for radiation 300%.
Wow.
So there's a huge, it's like a medical industrial complex of people who are pushing patients to get treatment that they probably don't need. I spoke about another man about 2 weeks ago who, same story, was being pushed for prostate cancer biopsy. It was a healthy man. He was 55. He owned this company in Queens, had a beautiful wife. He had no reason to get a biopsy, no symptoms, normal PSA, and yet people are being pushed to get biopsies, and it's wrong. And it's part of the problem that urologists are buying radiation facilities, and then they therefore are profiting from the radiation facilities. Peter Stark created a law in the 1970s, 80s, that prohibited doctors from owning and referring to their own facilities. And this is a legal issue. Our organization called Astro is challenging it. Urologists, many urologists are saying that's part of their need to be able to give radiation. Our industry, our medical group, believes that it is not correct, that urologists should see the patients, and patients should be free to get a second opinion. They shouldn't be pushed into something that's wrong. So I agree with you. Long Island has one of the biggest organizations of urologists. There's dozens who have bought in. They're co-owners of radiation facilities, and they've actually in many ways destroyed the treatment field of prostate cancer on Long Island because there's much less brachytherapy, there's much less other options, and 9 weeks of radiation isn't the best answer probably for anybody. And certainly many men don't even need that biopsy. So I agree with you 100%.
Can I ask one more question?
Sure.
Okay, so, the PSA obviously isn't a perfect test. I mean, I think when you take it with the family history and the rest of the, medical history, you get, maybe a better idea of what may be going on. But what do you think about the test PCA3?
I think that we need less testing. I mean, you started your phone call is, what about prostate cancer? Are we doing too much testing? I think we're probably doing too much testing. Probably too many men are getting biopsies. Too many men are going crazy. And if you read about, and I read just a few minutes ago, side effects of surgery, too many men are having their lives destroyed by prostate surgery. I have men come into me and their wives left them. And one man said, he came in with his girlfriend. He's been with her 5 years. He said, the first thing that he said to his girlfriend, and the girlfriend told me, he said, look, I've had prostate cancer surgery, and if you don't want to go out with me, I understand. It's devastating many men's lives. So let's focus on finding the men that need it and trying to cut down on all these unnecessary biopsies and fishing expeditions into people's prostates.
Thank you so much.
Thank you. God bless you. If you have other things to talk about, you can call during the week at the 212 Choices. I'm happy to speak with you. Thank you very much. I missed several calls, so if the callers want to call back, I apologize. I was on the phone with this gentleman. You're welcome to call back at 212 Choices, and I'll take your call. We have Dr. Eisen on the line, who is a Spanish-speaking oncologist who's dedicated his life to taking care of the Spanish community. Buenos dias. How are you?
Good morning, Dr. Liederman. How are you?
Fine, thank you. So we're almost at the end of the hour, but I do want to introduce you, and for people who have cancer and who speak Spanish and want to spend an hour or 2 hours going over the documents in their native language, Dr. Eisen is the man.
That's right.
That's right. And interesting about the data, because I just saw a patient that for 14 years he thought that he has one type of cancer, And when we reviewed the whole data, he went to a major hospital in New York. Actually, the pathology was totally different.
Right. He was told he had non-Hodgkin's lymphoma, and in fact, he had Hodgkin's lymphoma, which is a completely different disease, and he had a huge mass in the neck, and he came to you. He's about 50 years old. He wants to maintain his fertility. He wants to have a chance of being cured, and you will probably have a great chance of that with radiosurgery. Excuse me 1 minute. Whoops, I missed that call. If you call me back, I'm sorry, I hit the wrong button. So, doctor, how do Spanish people contact you, or anyone who wants to deal with you? How do they find you, day or night?
For the Spanish community is 917-836-8105.
Again?
917-836-8105.
All right. Thank you, and have a good day.
Okay.
I missed many phone calls, so please call me back, 212-CHOICES, 212-CHOICES, if you have a question. I'm sorry, we just had too many calls to take them all.
And you are one